With us on TVC News at 1. The Chief Judge of Oyo State, Justice Iyabo Yerima, says fundamental principles taught at home are essential to children's success as future professionals and responsible citizens. Justice Yerima was delivering a lecture in Elisha. We have details in this report.
This lecture was organized to reawaken the consciousness of the girl child and to address the pressing challenges and opportunities in advancing the career path of girls in Nigeria. Justice Iyabo Yerima calls on parents and guardians to take full responsibility for their children's upbringing. She stressed the need to instill strong principles in children to ensure they not only excel in their chosen fields, but also contribute positively to the society.
Impact values into your children so that when they are out there, they'll behave according to the values the parents have impacted in them. So that whatever sphere of life, they will be outstanding and they will impact that same values to the society in their place of work and all that. So the values parents impacts on their children is very, very important.
Parents in rural communities were also urged to prioritize the education of girls, starting from toddlerhood.
We say that women should end up in the kitchen. We are just wasting their entire life. We are wasting the life of the children. We are wasting the life of the community. Because that woman can be president. That woman can be an engineer. That woman can be a professor. That woman can be even the chief judge that we have in our group right now. So, saying that girl child is not good to be trained is actually thing of the past.
Only the parents that we need to appeal to. Many parents see that when you send a girl child to school, you are wasting your money, that at last she's going to end up in another person's home. And that's why I thank God for my own father. During my own time, it was not common for girls to go to school or university.
There were also lectures to educate students on the prerequisite requirements for various professions aimed at guiding their career choices. St. Margaret's Girls Grammar School was established in 1950, and this lecture was organized by the class of 1974 to mark its 58th reunion. The event concluded with the presentation of awards to 3 outstanding students from the last SSCE and the donation of furniture to some classrooms. Rafael Hamid, TVC News, Elisha, Osun State.
Let's talk health. Governor of Akwa Ibom State, Omoena, says the state will soon launch an independent emergency medical services and ambulance system to complement the primary healthcare services and the recently launched state health insurance scheme. He made this known when he received 6 out of 10 fully equipped ambulances at the government house, Uyo. Speaking while inspecting the ambulances, Governor Eno said the gesture reaffirmed his commitment to enhancing healthcare services in Akwa Ibom State.
We want to create an independent ambulance service system, standalone, headed by qualified personnel. We must have our ambulance service center, where these ambulances are placed. We train people. We have phone calls that can come in, they can pick up. Fortunately, this will complement the health insurance scheme that we just started. Pay the medical doctors, make them happy. We should be able to revive our health sector as part of our RISE agenda.
As you can see, there are 6 ambulances lined up, but there are actually 10, and 1 is to service each federal constituency. And you know, we have a very good network of roads. Anywhere you want to go to in Akwa Ibom, within 45 minutes, an hour, you're there. So we're sure that we're going to be improving on this thing, and it's just giving a marching order that we should train the personnel and set up a standalone agency for this. And actually, that's in line with the current federal government policy, which demands that each state should have their ambulance service as a standalone service.
Elsewhere, in a bid to appreciate the relentless efforts of security agencies, a non-governmental organization has taken breast cancer awareness to female police officers in Imo State to educate them on the signs and symptoms. Senior reporter Prince Uba has more.
The World Health Organization says that breast cancer is the most common cancer globally, with around 2.3 million new cases every year. It represents 1 in 8 cancer cases in both sexes and a quarter of all cancers in women, with 70% mortality occurring in resource-restrained settings. Health system barriers and patient-level factors with low levels of awareness and knowledge are contributing to low uptake of early detection services, with resultant late-stage diagnosis and poor outcomes. Worried by this trend, this non-governmental organization, among other humanitarian activities, is taking the campaign to law enforcement agents. The group is at the Imo State Police Command to spread awareness and encourage action among female officers to promote screening, ensure early detection, and support those affected by the disease.
Let us unite to break the stigma surrounding breast cancer, encourage open conversations, and also support research and advocacy.
Understanding the risks of breast cancer and recognizing the signs and advocating early signs can help to save lives. The Ike Odeme Foundation is committed to raising awareness and supporting those affected by breast cancer.
The NGO is providing an opportunity for all stakeholders to review progress, reflect and renew commitments in tackling existing disparities and challenges in assessing breast cancer care.
Even if you want to pray, is a good one. But when there is a medical issue, please rush to hospital. While you are doing the medical ones, do your spiritual ones. Do not allow your pastor to tell you that it's a spiritual stuff.
We tell you not to take some canned food because most of them contains preservative, which some of the chemicals that are used to preserve these foods can trigger the multiplication of these cells that cause cancer.
World Health Organization used this October to highlight the importance of early detection, timely diagnosis, comprehensive treatment, and the need to provide support for persons having the disease. Prince Oba, TVC News, Owerri.
For more on this development, founder, Love for Health, Dr. Yusuf Harun joins me now via Zoom. Dr. Harun, there are different types of cancer. What makes breast cancer unique and how is it diagnosed?
This is a very important question because breast cancer is unique and it's not only specific for women, as people have this misnomer. Breast cancer is the second leading cause of death among the cancers in women. However, breast cancer also affects men. Many people don't know that. Breast cancer can also affect men, and also men do have breasts. So it is very, very unique and different from other cancers because it has the early symptoms or early signs, which if they are detected early, they can be cured or they can reduce the mortality to significant 85%.
So how can it be detected? What checks can a woman or a man do to see if there are any lumps that need to be taken out, and how should they report it?
The early signs of this breast cancer is breast swelling, which appears as a breast lump. So if anybody, especially women, it is higher, breast cancer is higher in women than men, or it is more deadly in men than women. I will explain this shortly. So the way you can know, or a woman can know in particular, is she should examine her breast regularly. If she feels any swelling, number one, in her breast, which is strange, she should immediately see a doctor. If she sees any discharge from her breast, nipple discharge, she should also see a doctor. If she also sees something called orange-like appearance, in medical terms, medically we call it peau d'orange appearance, where the skin of the breast looks like the shape of an orange, the surface of an orange. It looks multiple holes and indentation. She should see a doctor. If she is developing sudden weight loss, she should also see a doctor. And the way to detect it, through scientific means or diagnostic method is through a mammogram or mammography. And the final way to confirm it is what we call FNAC, fine needle aspiration cytology. It's going to confirm if this is a breast cancer.
All right. And then you mentioned that it's more deadly in men than women, despite the fact that, women come down with it more. Why is that so?
The reason is very straightforward. Because as a man, I will never think of developing a breast cancer. And that is how many men will assume. Now there's the awareness of breast cancer in women. So even a woman has a breast lump. Now I'm happy to say this. It's not all breast swelling that is a breast cancer. There are some that are just a benign breast swelling. So that can be removed. That is not a cancer. But in men, why it is more dangerous is that men present at a very late stage. So when cancer is presented at the late stage, towards stage 4, where it has gone into distant metastasis. Metastasis means it has spread to different parts of the organs, like the kidneys, the lungs. It has even spread through the bloodstream to other parts of the organs. So that is why it is more dangerous in men, because men don't detect it early, and men don't assume they will ever have breast cancer. So when they do have it, it is at a late stage where it has spread to other organs of the body, and nothing can be done, unfortunately.
All right. So earlier you listed out some symptoms. So when an individual observes any of those symptoms, what should they do? And how easily accessible is cancer care in Nigeria?
Yes. The theme of 2024 cancer awareness in the world, and Nigeria inclusive, is don't stand alone with breast cancer. So anybody who has any of these symptoms, please see a